Welcome everyone to Cracking the Code of IVF or in vitro fertilization, Science, Ethics and Hope, a podcast dedicated to unraveling the complexities and marvels of in vitro fertilization, or famously called IVF. I'm your host, Dr. Padmavati Roy, and today we are joined by a leading embryologist, Dr. Shashikala Natarajamani from Kriya Conceptions, Chennai, India, to explore the intricate science behind IVF. We delve into ethical considerations surrounding it and share the profound stories of hope and perseverance that define the journey to parenthood. Whether you are considering IVF, supporting someone who is undergoing it, or simply you are curious about the nuances of this transformative technology. This episode promises to provide you with invaluable insights and expert perspectives. Join us as we crack the code of IVF and illuminate the path to creating life. We are doing this as a two-part series. Part 1 totally focusing on what, how of IVF, and part 2 we shall get into the technical aspects and into the depths of embryology. I welcome my esteemed guest, Dr. Shashikala Natarajamani, art consultant. Art is nothing but assisted reproductive technology, and she is also a scientific director at the Kriya Conception. And she is also IVF lab designer, auditor, mentor, and trainer in clinical embryology. And she is certified embryologist from ACE, that is American College of Embryology. Thank you for tuning into the EMS Technology Podcast. Let us embark on this enlightening journey toward together with Dr. Shashikala. Stay tuned. On July 25th, 1978, a historic moment unfolded as the first human conceived through in vitro fertilization. Pioneering birth through IVF, a girl named Louisa Joy Brown, now she is 46 years, was a beacon of hope for millions of families across the world. Born through a procedure developed in Britain, IVF, often hailed as one of the most remarkable medical breakthroughs of the 20th century, has since brought joy to countless families. Dr. Robert Edwards, one of the doctors who developed IVF, was awarded the Nobel Prize in Medicine in the year 2010 for his groundbreaking work. Since 1978, the success of IVF has continued to grow with over 10 million IVF births worldwide. More than 500,000 babies are born through IVF each year, a testament to its ongoing impact. In the United States, IVF accounts for 2% of all births, highlighting its increasing role in family planning. Have you ever wondered how science, ethics, and hope converge into in vitro fertilization? Join us, we crack the code of IVF. I'm your host, Dr. Padmavati Roy, and today we are joined by a leading embryologist, Dr. Shashikala Natarajamani from Kriya Conceptions. In vitro fertilization or IVF is an established and proven innovation in reproductive medicine for addressing some types of infertility. But we are here today with Dr. Shashikala to understand the crucial ethical and legal aspects of IVF as well. Let us now delve deeply into this subject to understand this new medical science, techniques, and latest developments. Dr. Shashikala, welcome to the EMS Technology Podcast. Thank you very much. Thanks from bottom of my heart to you for joining my podcast today to discuss this important topic. I hope that our listeners benefit from understanding the science, IVF, science of IVF, the process, challenges, and legal and ethical dimensions. To kick things off, please give our listeners a brief overview of in vitro fertilization and how it works. What inspired you to specialize in this field, and what continues to drive your passion for helping individuals and couples on their journey to parenthood through IVF? Over to you, Dr. Shashikala.
Thank you so much. That was a wonderful and great introduction. Thank you so much for that. IVF basically is a treatment for infertile couples, and it basically involves taking the sperms and eggs from the patients and maturing them, fertilizing them outside the body. Once we fertilize them and culture them, the resultant embryo is put back into the uterus. This is the normal process of IVF. Um, the scientific work on IVF was much before Louis Brown was born. In the sense, in vitro culture of oocytes was done as early as 1938, I think. So work has been going on from then. And the first baby, as you said, was Louis Brown, who was born in 1978 in Bone Hall. And the same year in October, in India, we had the first IVF baby. This was done by Dr. Subhash Mukharjee, and he followed a different protocol than the Cambridge team, where he did frozen embryo transfer. So this is about IVF, the beginning of IVF. If you ask me what inspired me to get into this, I think to begin with, when I was in the teens, I was diagnosed with polycystic ovaries. And during that time, there was not much information about that. And, it was thought as one of the, big problems to conceive. And this was informed to my parents, and they were so concerned about that. And those were my initial thoughts about why I was interested in infertility. Following my medical graduation, I did some time and training in obstetrics and gynecology, and I joined a senior gynecologist in Chennai. And at that time, IVF was not big in India. So for patients, we used to draw semen in larger syringes, and we just used to inject into the cervix. Even IUI was not big at that time. So that's when my curiosity, I started getting interested, and I heard of work being done in Cambridge, and then I started inquiring, are there any specific courses for this? That's when I came to know about the course in Nottingham, and I went and joined. And there's no looking back after that. I'm still as excited to see oocytes and sperms and embryos as I was 24 years earlier. And if you ask me again what keeps pushing me doing this, over the years in my practice, I've noticed that patients are always willing to accept reality. Maybe not always, most of the times they are willing to accept reality. But how many of these times all the information is given to them in a language which is understandable for them? That communication between the physician and the patient, and whether all the scientific information goes to them so that they make informed decisions. So that has always been my passion. And to be fair to patients, most of them are willing to accept reality. It's only that you have to put it in an understandable format, not using jargons and, in simple terms. And
simplification. Simplification is the key.
Yes. And, the end result, the outcome of it, when you see those embryos and the beautiful babies born and the happiness you see on those couples' faces, that's priceless. And, that's what keeps pushing me.
That is a very exciting and also passionate journey of yours in the field of embryology. So thank you for that great introduction. Given the complexities involved in IVF, could you walk us through the typical steps or process of the IVF, from the initial consultation to embryo transfer and to baby, as right now you mentioned babies, beautiful babies are born. So can you just take our listeners or our audience through this process once?
Okay. So in a normal menstrual cycle, a woman produces mostly a single follicle or single egg. Now, for IVF, we inject hormones to the lady and we make her produce more than one. Now, these follicles are monitored. Follicle is nothing but a bag in which the oocyte is there. So these follicles will be monitored over a period of time till we achieve the required dimensions of the follicle. IVF, basically, we are injecting hormones into the woman and make her produce more than one egg, which is the normal physiological pattern. And so once these follicles reach the desired measurement, we use an aspirating needle. It's not a surgery. We don't cut open the uterus or anything. We you must have seen the probe we use for scanning the follicles. So we attach a needle over the probe and scan the follicle and then aspirate the fluid from the follicle. And this fluid will be given to the laboratory where we screen and pick up the oocytes. And we, depending on the quality of the sperm and quality of the egg, we decide whether they go into IVF or ICSI. Once the process of fertilization is done, the embryos are grown in the lab for about 4 to 5 days, where the uterus will be replaced by the incubator, which has the particular pH and temperature which we need. And so these embryos go for 5 days. And then after the 5th day, we put the embryo, a good quality embryo back into the uterus. This is the normal process which happens in IVF.
Okay. Yeah. So what are some key factors that can influence the success of each of these steps? What are the precautions that that you as an embryologist need to take before an embryo is transferred from incubator to the uterus?
See, success in an IVF cycle will be determined by multiple factors. They are both on the patient side and on the clinic side. Now, when you come to the patient, there are multiple factors, like I said, starting with the age. As the woman ages, the quality of the egg goes down. The number and the quality will go down. Unlike men, women are born with all the number of oocytes they need for their entire life when they are born. So during the 5th month of intrauterine life, that is when the female baby is in her mother's womb, the maximum number of follicles are present. So these undergo a process of atrophy. Among these, from the time puberty starts, that is by way of hormonal stimulation, chemical cues and all that, once puberty starts, every month a few follicles grow. And among them, one will become dominant and burst. And that's called ovulation. And so this oocyte, when there is sperm available, it becomes a pregnancy. Otherwise, it is washed on with menstruation. This is what normally happens. So as the woman ages, the oocytes from this pool of reserve keeps going. So you can understand that at 40 or 50 years of age, this pool will be over. And that's when we call it as a menopause. So as the woman ages, the quality of her oocytes, both in number and the quality, they go down. So age is very important, both in male and the female. And you have a lot of lifestyle factors. For example, the day and night cycle is altered now because of so much of work from home and night duties and all that. So the secretion of reproductive hormones, melatonin secretion, all these things alter. And this will have an impact on the reproductive cycle. So that affects reproduction. Habits like smoking, alcohol. Smoking greatly affects the quality of sperm. Alcohol too, and your day and night cycle, everything, all these are going to alter your gamete quality. So the gamete quality is a very important factor from the patient side. Now, when you come to the other side, that is the laboratory or the clinic, right from the drugs we use to stimulate the woman to produce eggs, more eggs, not more than one. So those drugs, the amount, the quality, that matters. And our follicular monitoring, that is, while the follicles are growing, you do a scan from, say, day 5 or so, you keep monitoring them. So the proper assessment of follicles is very important. And then we also measure the blood work, how much of estrogen follicles are secreting. So that is also important. Now, when you come to the retrieval, that is when you take the eggs from the follicles, the temperature at which this fluid is maintained, right from the time we take it from the woman to the day when we put the embryo back. throughout this period, this has to be maintained at body temperature. So that is very, very important. Even slight alterations in temperature is going to affect. And of course, the pressure we use to aspirate the oocyte, that is very important because the higher pressure will cause damage to the microskeleton of the oocyte. So all these are small, small points which are very important. And let us not undermine the skill of the physician and the embryologist. Both are very important.
Absolutely. Yeah.
So we should not damage the gametes at any cost. So depending on the type of fertilization, whether we inject one sperm into an egg, which is called ICSI, or when we leave the oocytes and sperms together for them to fertilize, which is called IVF, every step of the lab procedures are important. And the air quality under which we work in the laboratory, that is of prime importance, because we are always using materials which can release VOCs or volatile organic compounds. These are filled everywhere, from adhesive, from the wood. So many things are, even from the wrappers we use, the packing material we use for the fluids and all that. So even those release VOCs. So all these are important factors to be considered, both in the lab and on the patient side. And some of the systemic diseases like diabetes, it affects the health of the sperm, the DNA integrity of the sperm. All these are very important. So before you go into an IVF cycle, all these medical conditions have to be checked, and the laboratory quality should be high to get a better outcome.
Yeah. So to summarize, the checks before a couple goes for an IVF, age is very important factor, and if they have any habits, they need to correct those habits, like smoking, alcohol, things like that. Diseases, especially diabetes or hypertension, whatever they have, systemic diseases, then these need to be controlled. Otherwise, and also from the laboratory perspective, there are these parameters which you mentioned, like
Constantly
volatile organic constantly, and also while extracting the embryo, also what kind of pressure that you are on the gamete you are
extracting the eggs or oocytes.
Extracting the eggs or oocytes, the pressure is very, very important, right? So these are to summarize these things. So listeners who are all actually listening to that, if you watch out for these factors which influence or positively influence your IVF.
Sorry to interrupt. I think there is no way the patients can have a control over the lab conditions. But they should look for a good reputed lab which has good results, and
exactly. I meant to say that. And also from the patient's perspective, they need to know if age, for example, a patient is coming 36 or 38 years of age, they have no children so far. So they need to little bit now take a decision to go ahead now for the IVF. That's what I meant to say. And if they have any habits, they need to correct those habits and monitor these diseases, so on and so forth. So that's wonderful. I think we started off. And Dr. Shashikala, I'm trying to get little deep into the technical details about the IVF process. Like, can you share the difference between conventional IVF and ICSI, or intracytoplasmic sperm injection?
Basically, it's the way we fertilize the egg and sperm. That's the only difference between IVF and ICSI. All the other procedures, where the injection of hormones to the women, the monitoring of follicles, the retrieval, and after the retrieval, the fertilization step alone is different in these two. The rest of the procedures, like culture of embryos, embryo transfer, will both be the same. In IVF, we put the egg and the sperm together in a petri dish. So the sperm will go and fertilize the oocyte by itself. In ICSI, we manually inject one sperm into one egg. We select the sperm based on some parameters we have, select the sperm, and then inject the sperm into the oocyte. The following steps in the procedure, that is the culture of embryos and then embryo transfer or embryo freezing, will all be the same in both IVF and ICSI. Only the type of fertilization is different. One happens by itself, and one we do it.
Yeah. Okay. So IVF is more, I think we can consider as a naturally happening over the natural selection process. ICSI is depending on the embryologist. So why do you take a decision to go for ICSI?
See, we need a particular quantity and quality for doing normal IVF. Suppose the numbers are less and the quality is poor, then we go ahead with ICSI.
Okay. ICSI, okay.
Yeah. When we have doubts that, whether the sperm will be capable of, fertilization, then we go ahead with ICSI.
Oh,
and of course, now we have other indications also, but basically the main indication is sperm quality.
Oh, okay. So when you find out that sperm quality is something which is a little bit not right, then you don't want to lose any sperm, so that you will manually select that cytoplasmic sperm injection. Okay.
Sometimes the morphology of the sperm might be poor, and sometimes in women, older women, where the FSH levels are too high, then we have the number might also be very less. During those times, we don't want to lose any oocytes, so we try to inject manually. So the indications for ICSI from the time it was discovered has been growing.
Okay. Yeah. So why this growth in the indications? What are the factors? Is it
that's
as
what
you
I'm
rightly?
saying.
Yeah.
So one is advanced age and lesser number of oocytes, poor quality of oocytes, high FSH levels, and sometimes when we are freezing the oocytes, because of this artificial culture conditions, the zona pellucida, the layer covering the oocyte, might become thickened. So during those times, we prefer ICSI to get better fertilization rates. So that way, from the time ICSI was done, from the beginning of ICSI, we've been going through an increase in the number of indications.
Oh, okay. Got it. Okay, wonderful. So that was very, please go ahead.
Basically, we don't want any failure of fertilization, and there have also been long-term studies on ICSI where the congenital anomalies are, a lot of issues with ICSI. There were a lot of long-term studies. And other than a few, like conditions like hypospadias, something like that, very few complications have been seen. And it's a long time since it has been done. So, yeah.
Okay. That was very insightful. Thank you. As we know, the journey through IVF can be both physically and emotionally demanding. What are some common challenges or hurdles patients typically face during this IVF process, and how can they be best prepare or cope with these challenges, the couples?
To start with, it's a emotional roller coaster.
Very nicely put it.
Yeah, one day you will hear your eggs are normal, the sperm is all right, we're going to inject. And the next day you might hear the fertilization is not good, or the next day fertilization may be good, they might not go into good embryos. So from the time you begin the cycle where you start the injection till the day you get embryo transfer, and also till the day you get your beta HCG test, it is a roller coaster ride. So I think the patient should be well informed. Prepare yourself well by going through authentic websites which give you information, and the financial stress is also too much. So you have to be very clear in understanding what steps are involved, how much it is going to cost. You have to take care that there is no hidden costs in your cycle. All that is very important because you have to plan clearly. Sometimes, because IVF is not a single cycle achievement, because it's never a 100% result-oriented cycle. So you might have to repeat 1 or 2 times. So for that, are you ready? Whether you're financially capable of doing it. And then sometimes one of the partners might be normal, the other partner might have some issues. And whether you have to mentally be prepared to accept that and encourage your partner to go through the cycle. So an understanding between you two is very, very important. So emotionally very demanding. You have the, an anticipation always. You don't know what is coming. So you might be dreading that phone call from the clinic, which will tell you either good news or bad news. So you will go through a lot of emotions.
Yes.
Better, it's always better to be well informed about it. Talk to your counselor in the clinic, talk to the doctor, ask them for the detailed explanation of the steps, what problems you can encounter, and check if you have any support groups in your area or within the clinic. Talk to others who have gone through it. So I think it needs some kind of mental preparation before you take the cycle, and also you have to be ready with your financial aspects, because halfway through there is no way to get back. And why I'm saying this is sometimes the patients may not realize that if you are left with excess embryos, then you have to freeze them and keep for future use. In that case, for freezing you have to pay extra, and in that situation, once you freeze, when you do a frozen embryo transfer, you have to thaw the embryos and put it back, and that also involves a cost. So that should also be understood. And to maintain these embryos under these conditions, you have to pay a maintenance fee. So these are all the financial implications in an IVF cycle. You have to understand everything fully before you step into the process.
Yeah, basically, to get into the process, you have physical, emotional, psychological, financial implications that you should be prepared before going into the IVF process. Very well stated, Dr. Shashi. So, considering the various challenges involved, prospective parents are naturally concerned about the success rates of IVF. So, could you elaborate on the factors that influence the success of IVF treatments? Are there any conditions or lifestyle choices? We have discussed some lifestyle improvements, but I want to have your elaborative opinion and answer from this. Like, can improve the chances of successful pregnancy?
Yeah. So if you look at lifestyle factors, like I told you earlier, your diet, your exercise, and your sleep. All these three play a very important role in the onset, progress of your conception, and delivery of a normal baby. Even if not IVF, these factors are important even for your normal conception.
Normal,
And, yeah. So we are seeing nowadays there is an increase in conditions like polycystic ovaries, which is mostly nowadays because of the change in lifestyle, the diet basically. A lot of junk food, and the time is not right, untimely meals, and so many other things. These are all very, very important. Of course, genetics plays a role in polycystic ovaries too, but to precipitate it, there are other factors which we can avoid. So these are the lifestyle factors in females. Of course, smoking and alcohol, like I told you earlier. And there are other conditions which you have no control over. Like, for example, you have endometriosis. The quality of oocyte may be not up to the mark like a normal woman. So that is also important. And of course, age. And because of career pressures, now I see women postponing childbirth and, trying to freeze their eggs and thinking that they can use it later. Now, freezing eggs is better now than before. We get good results with thawing of oocytes and IVF results. But still, when compared to a fresh oocyte, and I will still go with a fresh oocyte. If you give me an option of whether you want to work with a frozen egg or a fresh egg, I will always choose a fresh egg. And so, if possible, if no other pressures are there, it is better you complete your family earlier. Typically,
yeah, exactly.
Yeah, typically your oocytes are better when you're young. Less than 35 years old, your oocytes are almost, your oocytes are very good. As you age, again, the quality declines. So age is very, I can't stress this more. In our Indian culture, to draw references, remember our elders used to say, get girl children married earlier.
Yeah, exactly.
Yeah. Probably there is some truth in that, because as you age, the quality declines. I'm not propagating that girls should marry very early, but that's a fact that oocyte quality declines.
Declines, yeah.
Yeah. And conditions like endometriosis, adenomyosis, all this will affect oocyte quality. When you come to men, again, smoking, alcohol, high sugar levels, high glucose levels in diabetics, all that will affect when they have varicocele, which is a condition of where the veins are engorged in the testes. That is a condition where, because of the increased temperature, the sperm quality might be affected. So there are many conditions. When you ask me about success, people have to understand that it's not like you go to an IVF center and do your IVF cycle, you get a baby. It doesn't happen that way. Very rarely the first cycle clicks. Many couples have to go through repeated attempts, depending on the reason for which they are going through the IVF. For example, if you have only a tubal factor where everything else is normal, the sperm quality is good, your oocyte quality is good, only your tubes are a problem, then we overcome that by bypassing it, taking the oocytes out, making embryos, putting it back. In that case, the success might be much better. Whereas in a situation where the oocyte quality is bad, you might need more attempts. Similarly, when the sperm quality is bad, you might need more attempts. So we should understand that an IVF cycle can never be a success in the first attempt. Only very few get that. And success rates are also decided by the age. We usually calculate it year-wise. In less than 35 years of age of the woman, it's about 50 to 60%. There are some clinics which also mention about 70%. As the age goes up, like for example, if you reach 37 to 40, then the rates come down around 30% or so. And when you are beyond 40, it even goes lower, about 20%. So now you can see how age plays an important role in your success of the IVF cycle. Two things patients have to remember. One is you might need multiple attempts. It might not click in the first attempt. And second is the earlier the better.
Yeah, exactly. So in your practice and experience, what is your experience on how much minimal cycles one got pregnant versus, one got the success versus maximum? What is the minimum and maximum number of attempts of cycles?
It depends, Dr. Padma, because it is also up to the patient where they want to draw a line and how many times they want to repeat it. And that is where transparency in communication is very important, because the clinic also has to give them a true picture. See, there are some situations where even if you repeat the attempts, you may not succeed. So that has to be made clear to the patient. And yes, if there are chances, they can repeat the attempts 5 times, 6 times. I have seen some people going through 7 or 8 attempts also. It all depends on your mental threshold, your physical pain-bearing capacity, your financial capacity. So many things are involved.
Exactly. Yeah. So are there any, like your experience, are there any 1 or 2 cycles, the success of IVF you have seen in your practice?
Oh, many. There are many people who succeed in the first attempt also.
Oh, wonderful.
Yeah. Many succeed. Yeah.
So I think I have seen long back in news or somewhere, 70 or 60 years lady got IVF and then it was success. Is it true? Is it possible? So I'm very curious to know how, because a menopause is attained and there won't be any eggs in the yes. So how it is possible?
Use donor eggs from a younger woman, and make the embryo and then put it back into this woman. It's a very, very sensitive topic. The incidents you were saying is before regulations came in India. I think from 2021, we have the ART Regulation Act, where they've given a maximum age limit for a woman to undergo IVF, and for the men also. Women beyond 50 is not possible, and men beyond 55 is avoided. So this happened before that. And if you ask me if it's possible, yes, it is possible. But there are a lot of issues to be considered. The health of the woman in the first place, whether she can go through that pregnancy, all the complications associated with a high-risk pregnancy, and the welfare of the child. That's very, very important. As the child grows, whether this man and woman are capable of, going through the pressures of bringing up the child.
Exactly.
That's very, very important. So here, both health of the patient and health of the child and welfare of the child are very important. So if you ask me, it is not a very advisable practice. No.
Absolutely, yeah. So thank you for shedding light on these factors as well. So considering all these factors, how do clinics and regulatory bodies ensure ethical practices in IVF? Can you share any specific guidelines or protocols that are in place to address these kind of ethical concerns?
Each country has its own regulation. For example, if you take UK, there is HFE or Human Fertilization and Embryology Authority. And if you take US, there are regulations at multiple levels. You have the Center for Disease Control, you have the FDA, and you have the CLIA. All these three take charge of the regulations. In India, it comes under AR2 Regulations Act of 21. These regulatory bodies, they inspect these clinics from time to time. For example, a license is given for 4 years in UK, and then they come and inspect. Similarly, in India, every 5 years, now that the regulations have come, the license is given for 5 years. And then after 5 years, again, they come for inspection. Make sure that you adhere to all the regulations and then renew your license. So, and these clinics which are registered, every clinic which practices IVF has to register with the national board in India. So all your reports, all your results have to be communicated to the national board, and these are kept in a register. So there are regulations which for every aspect, like I told you, age, for a woman it is 50, for a man it is 55. So beyond that we cannot offer IVF. And for a donor, a woman can donate oocytes only once in a lifetime. And the number of oocytes that we can take from them, it is only 7. So like that, in every aspect, who can practice embryology, what education is needed, who can practice IVF as a physician, what is their education and experience needed, how many cycles should they have done. So every aspect of IVF has regulations, and these regulatory bodies, by way of inspection and records and all that, they keep a check. Even the clinic has to meticulously look into their records. For example, I can tell you one small example. There was a construction going on next to our IVF lab once. And we noticed that a couple of months we had a little fall in our success rates. So while we were troubleshooting, we understood this construction is causing a higher level of VOCs in our lab. And that's what was, once we corrected that and shifted the lab, then we went back to our normal rates. So we have to do a kind of self-check also in the clinic, from the documentation part to your lab quality and continuous assessment of your technicians, their skill. All this has to be taken care. And these regulatory bodies in every country take care of their IVF centers and their ART procedures.
Yeah, so that's really very interesting, because quality control plays a major role in healthcare, and that too in embryology. It is more into this embryology and IVF related things. You need to maintain the quality up to the mark. As you are saying, you need to internally also, all the IVF labs need to do a regular quality control checks, and also training of the technicians, training of the personnel. So that's very insightful. So what again going on to what screening processes are typically in place for sperm donors? Whenever now we are coming to the donor part, when you just mentioned about donating the oocytes for a woman is around 7. Only once in a lifetime a woman can donate her oocytes. And when it comes to the sperm, are there any screening processes if men or women are going to donate oocytes or sperm? Are there any screening processes before a lab can consider taking these as donations?
Absolutely. Before a sperm donor can donate, we check for his physical health, mental health, and if there are any genetic problems, family history of genetic issues, and whether he has any issues, and for infection screening, like for example, HIV, HBsAg, hepatitis C, syphilis. So we check him physically, whether he is physically fit in all aspects, all the biochemical parameters. And apart from all this, the main criteria is that his semen is normal with good count, motility, and morphology. Once we sure of that, then we look into his family history. Then we look into his, habits, the occupation. For example, a heavy smoker or drinker cannot have absolutely good morphology. So those things we consider. So you have to look into the physical aspects. You have to look into infection screening and genetic screening. All these three have to be considered before a person can donate.
Even for women, the same thing, right?
Yeah. Even for women, we have screening, genetic screening, infection screening, all that. Even for women, we have.
Yeah, that's very interesting.
Yeah, typically we take oocytes from younger women.
Okay. So looking ahead, what advancements in technology or legislation do you think will significantly impact the future of IVF and sperm donation, especially where there is AI, artificial intelligence, as artificial intelligence is increasingly utilized in the IVF processes to improve success rates and streamline various processes in the IVF cycle. For example, AI can be effectively applied from embryo selection, gamete assessments, personalized treatment from the clinical side, also lab automation, genetic screening, quality control, workflow optimization from the non-clinical IVF activities as well.
Yeah, exactly. You mentioned everything. So AI is everywhere. It is here to stay. And as far as my understanding goes, I think we have robotics, we have machine learning, and we have computer vision, right? So any process that generates a lot of data, AI is applicable. So in IVF, right from the beginning, from ovarian stimulation to grow the follicles, to monitor the follicles, in egg retrieval where you can assess the quality of oocytes. Those are all places where AI can play a role. And again, same in the laboratory, from sperm assessment, from embryo quality assessment, to determine the genetic analysis of embryos. Everywhere, wherever there is a huge data set, AI is applicable. There's a lot of research going on, a lot of studies are going on to see, what kind of advantage we can take from AI. And one small thing I would like to mention here is, see, for example, CASA, which is computer-assisted semen analysis. The computer is going to read the samples and give you a particular report. But the slide has to be prepared by us.
Okay.
So there is always this human interface. AI can give you a result as good as your input. So if your data set is not right or it is biased, similarly, for your CASA, if your slide is not prepared well, it is going to read that slide. So
same thing.
My feeling is AI cannot be 100% used in every protocol or every procedure. There is always going to be a human interface. Maybe someday, maybe 10, 20 years down the lane, we can have a completely independent ICSI going on with a robotic machine. I'm sure it will come someday. But human interface, I think, will be necessary in some form always.
Yeah, I agree to that. Yes, you're right. So now moving on to the next question, how can public awareness and education about the issues that we have discussed to improve, to ensure more informed decisions by the prospective parents, like we discussed about the age and habits, diseases and all. So do you think, like when I say public awareness, when a couple approaches to, let's say your setup or your lab, do you provide some educational assistance, awareness before actually they can take a decision whether to go ahead or not? what kind of training or education awareness sessions or counseling you would provide to them?
See, every couple, before they embark on an IVF journey, they go through counseling. Counseling about the entire IVF process, counseling about their gametes, the quality of the sperm, the quality of the egg, and if they have any other complications involved, that what are the probabilities, what are the possibilities of getting a healthy embryo, and the possibilities of their getting a pregnancy in the first or second or whatever attempt. So there is a thorough counseling happening to the couple. And there is a lot of information from authentic websites. I think you're going to give it in the end.
Yes, yeah.
So all these regulatory bodies regularly they publish information for the patients, so they can get information from there. And before starting their journey, I'm sure 100% sure every clinic has a thorough counseling session with the patient. They are given a very good psychological and biological explanations of all the processes that are happening, and that's where the embryologist comes into play, where certain aspects of the process the clinician may not be able to give all information. In that case, then the embryologist sits with the patient and explains how the sperms and gametes will be processed in the lab, and what they can expect at the end of 2 days, 3 days, and so on and so forth, so that when we tell the results, they are aware of it. It's suddenly you can go and tell them your blastocyst is looking good, then what is a blastocyst? So so we do explain to them everything before they start their IVF journey. Both the clinician and the embryologist, we sit down and talk to them, explain everything, and then only take them into the cycle. So they're fully aware.
Yeah, so this is what very important for anyone to take an informed decision, right? Without just before jumping into a new dimension for them, and they are confused when they are going for IVF. They have thousands of questions in their mind. So I think this is a great approach, and there is a lot of time and expertise involved in the IVF process, as you are describing a lot of things today, and almost I think 50% of time, I mean, physician or gynecologist, they need to put an equal amount of time and energy efforts into this complete IVF process. But I feel somehow still embryologists are often ignored and need to be there in the limelight in this treatment process. So Dr. Shashi, what are your thoughts on this situation? Especially in India, I know like in other countries, there is a separate embryologist time, and patients go through that consultation, and then they will go to the physician. So, and what do you think our fellow professionals or various institutions in India and hospitals they need to do in this important area of IVF?
Maybe I'll put it differently. It is not, I would say, not ignored, but less acknowledged. I mean, times are changing now than, back in those days. Now, embryologists are gaining importance. But still, if you look at even other countries, many of the websites don't carry the names of embryologists.
Okay.
If you see the team, it will only be the doctors and others. There is not mention of, I mean, many have and some don't have also. So there is no uniformity in the recognition of embryologists in all countries, not only in India. And the counseling of the patients by the embryologist is very, very important before they start the IVF journey. So to that extent, the embryologist forms, I would say, the backbone of IVF lab. And their skill and knowledge is very important to your outcome. So
it's crucial.
It's crucial. It is very important for I would say, directly proportional to your outcome. Their skill is very important. Their knowledge is very important. Like, the embryo selection and the sperm selection when they do it. See, all that is important. So there are many educational programs coming now which teach the basics of embryology, the theory of embryology to embryologists. And so this forms a very important, embryologists do need to be recognized. They need to be acknowledged. Like I said, many of the websites don't carry the names of embryologists. That has to, in fact, I found one interesting article published in PubMed about this. So things have to change. And I guess
mm,
more podcasts like this, where embryologists
mm.
speak the importance of their
Yeah.
work, has to come out, and things will change, hopefully.
Yeah, I completely agree with you because, as you rightly mentioned, embryologist plays a very important, crucial role in the IVF journey. As you rightly said, they are the backbones of the IVF process. So they should be given a proper recognition or acknowledgement. I think, yeah, we all need to work together to bring more awareness on these areas. And thanks for your just shared. As we wrap up today's episode, we have covered a lot of ground about the science, ethics, personal experiences surrounding IVF. We have discussed the intricacies of the IVF process, the ethical considerations, and some of the real world cases that highlight the importance of regulations in the fertility industry. So, before we go, Dr. Shashikala, do you have any final thoughts or advice for our listeners who might be considering IVF or sperm donation?
Yes, I think the first thing is that they should be well informed. That
Mm,
is, you need to gather information much in advance to, plan your strategy, go
mm,
through structured, authentic websites to get
mm,
information. And whichever
mm,
clinic you can, there is no harm in going to 2, 3 clinics and inquiring.
mm,
So you
mm,
can decide, the place which you're more comfortable with. So that
mm,
kind of
mm,
exercise can happen before you choose the place, and
mm,
plan well ahead with your finances. That's very, very
mm,
important. Halfway through, you should not, think that this was
mm,
not told earlier. So that is very important. And
mm,
the other important point I would like to say is that you cannot generalize medicine. Now,
mm,
generally, what people think is, see, this particular process she did, it worked for her. Why is it not
mm,
clicking for me in the first time? So the
mm,
conditions might be entirely different. Their reason
mm,
for not conceiving might be totally different from your reason. So you
mm.
can never generalize things in medicine, especially in IVF. So don't
Yeah.
draw conclusions looking at others' treatment process or others' outcomes. You understand
Mm,
that each individual is different, each situation is different, and your outcome will be based on your basic reason why you are not conceiving. Depending on whether it is a sperm factor or a oocyte factor or a tubal factor, your outcome is dependent on your situation. So
mm,
don't try to think that something which has worked for others will work for me. That's very, very
yeah.
important. So here you have to sit down with your clinic, your chosen clinic, and you have to discuss in detail what is the expected outcome for your situation. That's
Mm,
very, very important. And the final point I would like to say is, at some point you have to accept reality.
mm,
Correct? You cannot go
mm,
on, draining your resources, keep on trying repeated attempts. It is going to have an effect on your physical health, on
mm,
your mental health also, and your relationship.
mm,
Everything matters. So
mm,
you should be able to recognize that particular point where you say, okay, I have given my best, I've tried,
mm,
and it is not
mm,
happening. So let me look into other options. That
mm,
reality, that realistic analysis of your situation, you should be able to do.
mm.
Not
Yeah.
endlessly go on, doing procedure after procedure, training your resources. And by the time, uh, your age also matters. No, you can't go on forever like that. So draw a line somewhere, accept
Mm.
reality, and look for other options.
Yeah, exactly. So, yeah, because it differs from case to case, and one cannot compare with others. So they got success in 2 cycles. I'm in eighth cycle. I'm still
Why am I not
nowhere.
getting? Yeah.
Yeah, so that should not be there. So that's wonderful. And thank you so much for those valuable insights, Dr. Shashikala. In this episode, Cracking the Code of IVF, Science, Ethics, and Hope, we just covered the introductory aspect or part one in this episode one. We will be doing in future episode two also, which will be an in-depth about embryology and also some other technical details we will be discussing. I will provide all the links to the resources that Dr. Shashikala will share with me, and also further reading for our listeners some websites who want to learn more or seek support. In the episode description, you can find all those things. Thank you to
Thank
our
you so
esteemed
much.
guest.
Yeah.
Thanks a lot, Dr. Shashikala. Thank you.
Thank you
And
so
if you
much, Dr. Padma. It's been a pleasure talking to you and wonderful discussing all the topics. My pleasure. Thank you so much.
thanks a lot. Thank